Hey, welcome to Healthy Time with Peer Docs. Just a reminder this is for informational purposes, this is not medical advice. Please follow up with your primary care provider should you have any questions or concerns. Enjoy the episode. Hi, welcome to Peer Docs. As we know, February is Heart Health Month. And today I have a very special guest, Miss Charlotte Jackson, who has come to share her story. Many times, us as women, we're so busy taking care of everyone else and we forget to take care of ourselves. 44% of women are unaware that they even have any type of heart disease. One third of women actually succumb to heart attack or different causes of cardiovascular disease. So today I actually have a survivor to talk with me a little bit about her experience as she, underwent a heart attack. So Charlotte, tell me a little bit about you. Welcome.
Thank you. Glad to be here. I am Charlotte Jackson. I am a registered nurse. I've been a nurse for 21 years. My primary specialty is dialysis, 17 years of that. I have recently changed career paths. Now I'm working in administration.
Awesome. Awesome. So tell me, I really just want to get right to it. Tell me about what happened. What was your experience like when you found out that you had had a heart attack?
Actually, I guess the best thing to say is I worked through COVID, no problems. The end of the summer of 2024, I caught COVID, had a cough. The cough would not go away. I had gone to the doctor several times. My primary provider had given me a Z pack. I had been taking over the counter meds, allergy meds, continuing to work. They told me the cough was the last thing to go. The night before my event, actually, I had gone to the trust care because I noticed I had started to run fever. I had been doing dialysis that particular day. I got off at 7:30. It was raining cats and dogs. Of course, I got wet getting to my car from UMC, and I said to myself, "You better go see somebody." So I went to the trust care. I got a Decagon shot, a Rocephin shot. They gave me a Z pack. Dropped my prescriptions off, went home, went to bed just like any other night. About 5 a.m., I woke up and I was short of breath and just felt a little discomfort. And I'm thinking, okay, maybe it's a little indigestion. I had had a few chicken nuggets before I went to bed, something I didn't need. So I said, okay. I got up, drank a Sprite, 2 Tums, got in the recliner. I napped a little bit at about 9, still short of breath, wasn't feeling good. I said, well, let me go to my primary doctor at UMC. And I did, drove myself there. But as I got to the office, went to the waiting room, I started feeling worse, hot, short of breath, still feeling like nauseated, a lot of nausea. So the receptionist said, don't sit, they're coming to get you now. Took me to the back. Of course, they got my vital signs, waiting to see the doctor, and all of a sudden, felt as if something was sitting in my chest. I started crying. They ran the EKG, and guess what? I was having a heart attack.
Wow.
So I got on the ambulance across the street, took me to the emergency room, did a workup, found out I had pneumonia. I was septic. So they immediately put me on high flow oxygen, and I was on IV fluids for the entire hospital stay. I was in the hospital for a week. I had a echocardiogram, EKG. I eventually had a heart cath, but thank God I had some minor heart disease, but no blockage. So I did dodge that bullet.
If you don't mind me asking, how old were you when this happened? What, because, oftentimes we
52,
think, we 50 years old. Wow.
52, taking care of people, working every day, thinking it's just, COVID. My advice to anybody, over the counter stuff is over the counter. If it's not working, go to a doctor. You're going to need some extra help. If you're not feeling better and 2 or 3 days, please seek medical attention.
And one thing I really want to just highlight now is, from what I heard, this was ongoing. You noticed it that night, you got up early AM, and you never once until later really described actual chest pain. And so that's the thing I want to say for women, oftentimes our symptoms are not those typical things that we think of, chest pain in the beginning. Sometimes it's just feeling tired and feeling short of breath like you did, Charlotte. So I'm grateful to hear that you had a primary care, physician or provider that you were going to go see to seek help. And it sounds like they really expedited everything. Now, one thing I want to talk about is tell me about your history. What was your history like at 52? Did you have high blood pressure? Did you have cholesterol issues? Tell me a little bit about that.
Now, my history, of course, high blood pressure, that runs in the family. I had been on high blood pressure meds maybe for about 2 or 3 years. My cholesterol, of course, elevated, but I wasn't on medication at that time. Of course, my weight, every year they'll say, okay, you need to drop 20, 30 pounds. That's ongoing, still working on that. But I didn't start cholesterol meds until after my cardiac event and my heart cath. Now, I must say, chest pains, I never really had chest pains, but I did have upper abdominal gastric discomfort. When you have indigestion and you think maybe it's gas, maybe it felt more like that. When I realized that it was more pressure than pain. That's what it felt like, pressure. And most of my discomfort was from the coughing. I had been coughing with the pneumonia. That to me hurt it worse than the pressure in my chest.
So, how did you feel? How did you respond when they got the EKG and told you, Miss Jackson, you're having a heart attack? What was your first response?
Oh my God, not now. I want to see this grandbaby again. Basically, at that time, the feeling of not being able to catch my breath, to me, that was the worst feeling ever. Just not having enough oxygen, feeling as if I was suffocating. To me, that was scarier than the pain itself. Just not being able to breathe.
Have you ever been a smoker in life? Any history
Never.
of smoking?
No history of smoking.
And tell me, what kind of things did you eat, or do you eat? Because I want to talk about prior to the heart attack. What was your diet like?
Typical, I've always been a vegetable type person. I like a lot of raw vegetables, a lot of fruit, greens. My problem is sweets. I love the cakes and the candy and the
Mine
sugary
too.
drinks. But as far as a lot of fatty meats, I've never been a person that like a lot of meat. And when I sit back and I think about it, had I been a lot of carbs, a lot of meat, I probably wouldn't have had the outcome that I had.
Awesome. So, how would you say overall, now that you've gone through this and survived this, how has it changed your life?
I've done a complete lifestyle change. I've changed my jobs, and I don't feel guilty for putting me first. Before my event happened, working full time, assisting with elderly parents. I have two parents. My dad is 83. My mom is 80. And I must say, I have an older sister. We share, taking care of the elderly. She just had a cardiac event Friday. So, as Black women, we have got to learn to put ourselves first because we cannot take care of others if we're not helped.
And if it's okay, I just want to pause and say Miss Charlotte and I spoke today for the first time. We've been playing phone tag a little bit. And that's the first thing she said, Dr. Pierre, I'm actually leaving the hospital. My sister just had a heart attack. So, genetics is something we don't always, or not always, we don't always know. And of course, we cannot control it. And so it's important to talk to our family members to know what our risk factors are for hypertension and anything that can lead to, cardiovascular disease. So thank you for sharing that. And thank you for taking the time to talk to me with, your family things going on.
My pleasure. Thank you for having me.
All right. So as far as medications, any issues with taking your medications now? Did you find that after having your heart attack, you've had to take a lot more medicines?
Actually, they added a baby aspirin and, of course, the Lipitor for my high cholesterol. But I had been on, blood pressure medicine for, I know, over 3 years at the time of my event. But I would rather take those 3 pills than to experience what I experienced.
What is something that you hope that they know and take seriously about heart health?
It's a lifestyle change. Sometimes when we're thinking, okay, let me get something fast and easy. And that's not always the best thing. Sometimes we have to think about and do what we call meal prep. You have to plan your menus and actually, make a conscious effort to eat things that's going to give you the energy you need, but not just a lot of empty calories. And stay on the move. Yes, when you work, you want to, come home and relax, or you are doing other things, running with children, taking care of the elderly. But sometimes, park farther away in the parking lots and walk. Getting those extra steps in is important and it's worth it.
It is important. And there's one more thing I want to know that I didn't ask is what was your recovery like? So after, going through the process, what was your healing like in recovery?
Surprisingly, it was fairly quick. It was just that one episode. And once I got the antibiotics that I needed to take care of my sepsis, it was after I started to recover that I realized how tired I was, because I had been going on fumes, just going, taking something and going, just not feeling good and just doing just enough to just keep going. But actually, when I had that event and actually slowed down and looked at all the things that I was doing every day, I didn't realize how much I was juggling and not seeing about me. So I actually recovered within 2 weeks. I had felt better in 2 weeks than I had felt in 6 months.
Excellent. Excellent. Well, this is amazing. I'm just grateful that we can share this with other women, not only women who look like us, but women just throughout the world to know oftentimes we just run and, we think we're super women and doing for other folks. And we need to realize that we need to take care of ourselves. I'd also like to take a moment to highlight, things that lead to cardiovascular events like hypertension. So if you should be on blood pressure medications, be sure that you are taking them. Be sure, according to the American Heart Association, you should be doing at least 150 minutes of exercise weekly. This can include things like taking a brisk walk or cycling or swimming, anything that gets your heart rate. And if 150 minutes sounds daunting, then you can break it down. We'll take 10, 20 minutes a day, whatever it takes to get yourself in that lifestyle routine. One more thing I'd like to highlight is diet. Like she said, lifestyle changes make a huge difference. Adjusting the amount of sodium in your diet. A couple of things that I like to recommend are the Mediterranean and DASH diets, which are great for ensuring that you're getting proper amounts of fruits, vegetables, and fiber. So we're glad to share this story. We're glad to share some tips in hopes of saving more lives, especially when it comes to our women, that they're aware on how to preserve themselves and live a longer life. Did this experience change your perspective on life?
Definitely. It changed my perspective.
Tell me about that.
Before this experience, I guess I was more task oriented. How many things can I get done in 24 hours? I have this, and this to do. Now I'm more of, there's 24 hours in a day, 12 hours I'm working. I'm going to spend some time for me. I make sure I have that mental health time to kind of exhale, realize that you can't get everything done. It's okay to leave some things to the next day, the next week, and just pace myself. I don't have to be the Energizer Bunny. I don't have to say yes to every task and everybody. It's okay to say no.
You're preaching to me. You're talking to me. Thank you for bringing up mental health and stress. Oftentimes, again, us as women, we deal with stress differently, and we keep going, and we think we don't need help, and we don't ask for help. And stress, again, is can lead to heart attacks. So we just want to keep that in mind and find ways to relieve stress, whether it's breathing exercises, whether it's going for a walk, whether it's calling your favorite girlfriends, to vent, whatever it takes. If you need to see a therapist, whatever it takes to help reduce some of your stress, because that can also affect your heart health. Another thing is sleep. You made me think about sleep. So, the average amount of sleep that we should get is 7 to 9 hours. And so oftentimes I know me personally, most nights I don't get 4 to 5. And so that's not good. And so we want to ensure or remind everyone that you do need an average of 7 to 9 hours of sleep. That does vary based on personality, etc. But that is the recommended amount of sleep that you should get. What do you wish more people knew about heart health?
I would say diet. Oftentimes, when you go to the grocery store, we tend to meal plan around what will last the longest. If I don't get a chance to cook it, say tonight, the shelf life. We plan our meals around, what will fill us up faster, what can we finish and, cook faster. And I think we have to think about preservatives. They are not our friends. And honestly, if you prepare a meal and the ingredients you use, if they don't go bad within a couple of days, then more than likely you should not eat it.
Thank you. And another thing I often say is, we think about the details of different diets, Mediterranean dash, what have you, but just make your plate colorful with fresh fruits and veggies. And then you know that you're in the realm of consuming a healthy diet. Moving forward, do you feel more empowered or cautious about your health now?
Moving forward, I think it's a little of both. I feel more empowered as a Black woman to advocate, for myself. If the medication regimen or the recommendations that we're given, if I'm not feeling better, go back.
Mhm.
I'm more cautious about what I eat and the amount. When things taste good, we tend to overdo it. So I'm tuning into portion control and making sure my plate is colorful, like you said, and don't gravitate to just the things I like. Try things that I've never tried before, just to see if it's something that I may be able to incorporate into my diet.
And I must say, I'm a witness. I called her a million times to have this hot, fancy dinner ready for her. And she was like, no, just, vegetables. What did you say? Snap pea, anything green, carrots. And so that is what we served her today. So
From talking to my sister with this experience that we just finished, I realized too that sometimes medication compliance is a problem. We tend to get on Google and look at a lot of the side effects and things. And with that being said, I think it's important to, first of all, have a provider that you trust. Second of all, when you start looking at side effects, discuss it with your doctor. Don't just decide to stop your medicines. It could be something else that you could try, but it's important to work with your practitioner and do what they advise. Google is good, but sometimes you have to trust the professional and don't worry about the side effects, because if you were to pass away, you definitely won't have side effects to worry about.
well said. Thank you for addressing that. And it's true. We oftentimes, patients will say, well, I read this on the label, I read that. And really, with any medicine, whether it's a nutraceutical, that means a herbal, or whether it's prescribed, there's risks and there's benefits. But if you allow us to have a discussion about it, we can talk about, okay, the benefits here of protecting you from cardiovascular disease outweigh, let's say, the leg swelling. And like you said, sometimes we can find things that can have that benefit that we need, but may reduce or have zero leg swelling. So definitely have a conversation with us about it so that we can put you on the optimal treatment plan so that we can hopefully, save your life and have everything where it should be from a cardiovascular risk standpoint. Once again, I just like to thank you, thank you, thank you. We are praying for your sister as she recuperates during this time and she's on the road to healing. Once again, if you can find us at prdocs2 at Gmail and prdocs on Instagram should you have any questions